Hi, everybody. My therapy that I was assigned is called community group therapy. Previous studies have shown that those who acquire aphasia end up losing their social connections because they have a difficult time interacting with their friends and family. And by participating in group therapy, it actually shows a higher satisfaction with social interactions and an increase in participation in social interactions. So really the function of the community group therapy is to increase their functional communication so that they can have better social interactions, hopefully generalizing to real world situations. This type of therapy is really kind of fluid and there's no direct targets. Really, it's more just that functional communication aspect. And it helps the clients really just practice their types of communication. And they really learn from their peers and gain strategies for communicating in real world scenarios. So for a baseline measure, you'll want to administer the WOB as one of the assessments. And then there's a couple other assessments you can use that are functional communication assessments that you can later administer to determine progress for your clients. One of them is called the Shortened Porch Index of Communicative Abilities, and the other that's recommended is the Communicative Abilities of Daily Living. So those are really functional communication assessments that you can administer as a baseline. And typically this type of approach is good for those with moderate to severe chronic aphasia. So it's not necessarily one type of aphasia, but it works well with those with chronic aphasia. So after you do those baseline assessment measures, you can group your clients with like severity if you'd like, or you can do any kind of grouping you'd like, and you can group them in about 7 to 10 is recommended. The sessions are about 2.5 hours for twice a week that you'll gather your group, and the treatment typically lasts about 4 months that you'll want to probe and see about their progress on their goals. So the first 90 minutes of the therapy is really group discussion based. So the article that I read really says that you'll want the clients to kind of lead where they want the topics to go if they want to discuss something in particular. But if they don't really have anything that they want to discuss, or if you're just starting and their participation is low, as the clinician, you may want to come up with some ideas of discussion items that they can have, group discussions for. Some ideas would be, things that are going on in their lives, people that they want to talk to. And it can be as simple as, if there's, current events happening or anything like that. It could be really any topics that you think that will facilitate conversation amongst the group. After the 90-minute group discussion, there's usually a 30-minute break session. And this consists of the clinicians kind of leaving it open for families to come in and participate, or caregivers to come in and participate with the group. And it says that they serve refreshments, but I'm sure that that's optional. But really it just kind of gives them a break, and it allows them to kind of not have that facilitated group discussion, but more of like a general, families are invited and, but they're still using conversations and openly communicating with one another. After that half-hour break, there's another hour of therapy, but that hour of therapy is usually activity-driven. So it's not so much of that group discussion. It's more, you can play games, you can have participation activities where they're doing exercises, or they can have group-led activities. It can really be very open-ended with this type of therapy. So there's not really one specific activity that you can have. But some examples where they could play card games, or I think at the adult clinic they have them play board games like Pictionary, anything that really facilitates language. Like for example with Pictionary, you can have them do word finding and naming and a lot of those tasks that they might have difficulty with. So there's a lot of things that you can do for that, and it's really open-ended. So in this case, the members of the group actually can have an opportunity to lead activities, whether it be in the group discussion activity or in the activities in the final hour. So that can really give them some ownership of the participation within the group therapy. So that's also optional for them if they feel like they want to do that. It can give them a lot of leadership activities that way. And then after the 4 months of this group treatment, You can probe them by giving them the assessments that I previously mentioned, and that can kind of give you a good idea of how they're improving in their abilities. So in general, this treatment is better with immediate administration rather than a delayed. So in the treatment article that I read, they started certain clients immediately after giving their assessments, and then 4 months after giving their assessments. And those that received immediate therapy actually did better and had more improvements in their overall functional communication than those that waited 4 months for their treatment. So definitely this is something that you'll want to start with your clients right away. But this study didn't necessarily look at if it's better in conjunction with individual therapy or if individual therapy has better gains. But I would assume, based on kind of what we're doing at the adult clinic, that individual therapy along with group therapy can really give them a lot of strategies to communicate. So within the group therapies, you can facilitate conversation as the clinician by helping them with various forms of communication, so they can really communicate in any manner that works well for them, whether that be verbally, written, drawing, or gestures, as long as they can really try and get their message out and be heard and understood by their social interaction partners and communication partners. So this didn't work as well with those who had auditory comprehension deficits for obvious reasons. It might be more difficult for them to participate in conversation if they can't follow the conversation. But that doesn't mean you can't do it with those individuals. It just really means as a clinician, you have to be aware of that and really help them to facilitate that conversation and help them to understand, which is really a real world application that they're going to have to understand how other people are communicating with them, with social interactions. It's also found that this is really good for motivated and increases social interactions with those who participated. So as long as they're really motivated to want to have social interactions, it can be really beneficial for the clients who participate in this. Even with those that we've heard from in the adult clinic, they really have a better grasp on their disorder because they're finding other people who are similar and different to them and seeing kind of the vast array of aphasia that's out there. And it really helps them kind of understand their own deficits and apply it to a real world situation. And really for this study, the clients and families rated very high motivation and satisfaction with this treatment. It really gives them a lot of opportunities to have social interactions and to apply them to future social interactions. And it really benefits them in real world situations. And it also just generally gives them a lot more confidence with social interactions because they're really practicing in a low stress environment where the clinician can facilitate conversations, whereas in the real world, they'll have to go out and kind of facilitate them for themselves, but they're really getting a lot of strategies through this type of treatment. So I hope that helped, and thanks.